Hello, everyone. Welcome to our urinary tract focus week. So this week we're talking about bladder problems and kidney problems and stones and crystals and all the different things that can occur with our pets. And I have a special guest today, Dr. Barbara Fougere from Australia. And she is one of our featured speakers at the big international Naturally Healthy Pets event in October in Orlando. So this is a great way for you to get to know her a little bit. And we today want to talk about nephritis. So Barb, thank you so much for agreeing to be a guest today.
Thank you.
So let's start off with, can you give us a definition of nephritis? And then we're going to follow that up with, do you see this more commonly in dogs or cats or both?
Yeah. So nephritis can occur in dogs and cats, and nephritis refers to inflammation of the kidneys. So not all kidney disease is the same. The kidneys play a really crucial role in removing waste products from the blood, and they help regulate fluids. They help maintain the balance of various substances in the body. So when inflammation in the kidney occurs, when the kidneys are inflamed, that can interfere with their normal functioning. And so there are various causes. It could be a toxic insult, something that the pet has been exposed to, toxic mushrooms, for example. It could be an infection that causes inflammation, and sometimes some immune disorders as well. So in a nutshell, inflammation of the kidneys, that's a little bit different than chronic kidney disease. Nephritis can lead to chronic kidney disease, but it can also potentially be very treatable and reversible. So nephritis is more of an acute condition, something that happens in the short term, but it can lead to long-term problems if it's not treated properly.
Exactly. Yeah. So as you were saying that, and I was thinking, oh yeah, the Lyme nephritis. So I don't know if you have Lyme disease in Australia, but Lyme disease is an acute problem, but it definitely, if we get that Lyme nephritis, that inflammation of the kidneys, then it leads into that long-term kidney disease or kidney failure. So they're really kind of two separate things. So basically we're dealing with an inflammatory process. What are some of your kind of go-to things that you would say, okay, I've diagnosed that we've got inflammation of the kidneys. What do you jump on to say we got to calm this down as fast as possible?
So because there are different causes of nephritis, the treatment can vary, and sometimes, conventional medicine is really important. If there is a serious infection, sometimes we need to use antibiotics. But one thing that I use as a go-to is the herb called milk thistle, silimarin. And one of the reasons why is it is nephroprotective, meaning it helps protect the kidneys. It can help augment the efficacy of antibiotics in some cases. But that important component of being an anti-inflammatory and helping to protect the kidneys while the antibiotics work, I think can make a big difference. And it's a very safe herb to use when prescribed at the right dose. And I think it can make a big difference, particularly as some forms of nephritis can actually be brought on by particular antibiotics as well, which is kind of interesting. Some antibiotics can cause some damage to the kidneys. Gentamicin is one of those antibiotics. So if you have to use gentamicin because that's the only thing the infection will respond to, we add in the milk thistle and we can offset the potential for those side effects.
And that is a really good point. Because milk thistle, we talk about using all the time over here. And we almost always think of it as clearing the liver. And so everybody, I think it's kind of like right in front of you, like, oh, we've got elevated liver enzymes. We're going to throw the milk thistle on there. But I don't think that many people jump on that to spare the kidneys. And so that's like gold right there.
Well, milk thistle has this really amazing ability to help stabilize the cells inside the liver. That's one of the ways that it works with liver conditions, is it helps protect the cells inside the liver from damage. And it does the same thing in cells in other parts of the body, including the kidneys and also the pancreas. So with pancreatic problems, milk thistle has the same protective anti-inflammatory value in those organs as well. So I think it's an all-round good guy. Lots of vets know about it, so you can usually talk to your vet about it. And there are veterinary products that contain milk thistle that can be used as well. So it's a very, very nice complementary medicine and adjunctive medicine
for a lot of different things.
Yeah.
So that is awesome. Do you, and I did not do a good job with the introduction, but Dr. Fougere is a veterinary herbalist. She's like a brilliant herbalist. So if she says it's good, we're going with it's good.
There are many, many other things that can be used for nephritis, many other herbs as well, but just as a go-to. And if you want to incorporate herbal medicine into the treatment of your pet, then your veterinarian may be open to this, but there are veterinarians who are trained in herbal medicine who can certainly work with your veterinarian to provide the best of both worlds, the conventional care and the natural medicine approach as well.
Yeah, absolutely. So what's your next go-to?
Well, the next go-to is in conjunction with a conventional approach, because it does depend on the causes, as I mentioned. Sure. The next go-to would be the diet and nutrition. And I favour real food diets, whether they're commercial, complete and balanced diets or potentially homemade diets. But an anti-inflammatory diet is really important to reduce the inflammation in the whole body and therefore the kidneys as well. A lot of diets, poorer quality diets and a lot of highly processed foods tend to be pro-inflammatory in the body. Right. So, one of the first things we want to try and do is gradually shift over to a more real food diet for its anti-inflammatory benefits. Not always easy, particularly if the animal is really unwell with nephritis. Sometimes you've got to wait a little while because you just want them to eat something. But that's kind of one of the strategies that we would use.
Absolutely. Yeah. And, changing a dog, if you put a plate of whole food in front of them instead of a processed food, they're probably going to go, yay. But if you do that with a cat, they're going to look at you and say, what is that?
Exactly. Exactly.
Why would I touch that?
Yeah. But, when cats are really unwell with kidney disease, you'll observe them. They'll want to chew on grass because they are feeling unwell. And wheatgrass is one of the things that I would actually want my cat to chew on if they had nephritis or kidney disease, because it is full of antioxidants and full of very beneficial plant-based chemicals that can really assist, and they seem to like it as well. It's a bit like having a wheatgrass shot.
Yeah.
It's a nice detoxifying agent as well.
And how about things like chlorella or spirulina? Do you think they have a place for the nephritis?
Oh, absolutely. So any of our plant-based supplements like spirulina, like chlorella, just like the wheatgrass, are full of chlorophyll and other plant-based chemicals that have an anti-inflammatory effect, and not just anti-inflammatory, also antioxidant. And when we've got kidney disease, whether it's nephritis or whether it's more chronic kidney disease, there's a lot of oxidative stress that goes on. This has actually been studied in cats and dogs, and that oxidative stress perpetuates some of the chronic nature of these conditions. So antioxidants are very, very beneficial. And this is where chlorella and spirulina and some of these other plant-based products as supplements can be very, very beneficial.
Which is so funny because we're always talking about, well, we need a species-appropriate meat-based diet. But and it's funny because I do get some pushback from people who are prey model raw feeders. Yep. They're like, no plant material. And I'm like, oh my gosh, some of these are so incredibly beneficial that why would we leave them out? They can make a huge difference.
Absolutely. And, in prey-based models, certainly the research that I've looked at that's been published, most predators will eat the guts. Not necessarily first or last, but there will be plant matter. Most of their prey are herbivores, and it's going to be digested plant matter in the guts, gizzards, intestines, whatever. So they do get some plant-based material as part of their diet, and they've been observed to chew on grasses and things like that as they need to. That zoopharmacognosy, where they take in things that they we think in some cases helps alleviate discomfort or a feeling of not being well.
Yeah, it's really interesting. I've read so many studies, and particularly with horses, and they say plant a hedgerow with all these different herbs and things, and then just let them self-select and treat themselves. And I've always had herb gardens, and particularly with my larger dogs. I used to have large dogs before I had the little guys I have now, and they would go out and they would just pick out what they wanted and just chow down on the yarrow or chow down on the basil. They would just pick whatever it was. And I loved it. It's so cool when you give them that opportunity and you put them out there and say, well, what's going to make you feel better? And, if we look at herbal medicine and Chinese medicine and, things that go back thousands of years, I think that all of that came about by observation, by eating something and seeing how it made you feel, or having an animal that had certain symptoms and seeing what they chose to eat. And I think if we would just pay a little more attention, we could learn a lot more. The research in that area is relatively limited, but there are lots of studies where we've observed animals chowing down on clay, chowing down on particular plants. I would put a caveat in there and say that some animals will eat things and get very sick, and some of our household plants can do that. Lilies, for example, can be very toxic and cause nephritis in cats. So we have to be very, very careful in sort of, that animals know what to have. But you're absolutely right with horses and hedgerows, and, being able to self-select. A lot of the toxicities that occur with cattle and sheep is when they're in a field that has a monoculture and they are eating just one plant, and they certainly can get toxicity. And I'll give you an example. St. John's wort, or Hypericum perforatum. I was taught as a veterinarian that was a toxic plant, but it is a really wonderful liver herb and a very good neurological herb as well when it's used in the right amounts. But certainly sheep and cattle have, had toxicities from eating too much. Yeah, for sure. I mean, and I worry about that with our pasture-raised animals on our farm. I was looking at the pasture the other day, which it's winter here, so it looks like poo. And I'm like, there's a lot of onion coming up in that field, and that is not what I want my horses eating. So, ew. Definitely. So, well, this has been just great information. So milk thistle, I don't know that would have been the first herb that I would have grabbed for nephritis. So
just as a go-to,
you learn something new every day.
Well, as a go-to, and most veterinarians have heard about it. Even if they're not a herbalist, it's an easy one to get hold of. There are a huge list of herbs that can be beneficial. I can think of Angelica sinensis, which is dongguai. I can think of Rhamania glutinosa, which is Rhamania. These can be really important in helping to prevent the long-term consequences of nephritis, because they can stop the scarring and some of the fibrosis that can occur in the kidneys. Nettle and nettle seed can be very, very useful as an anti-inflammatory for the kidneys. So we could go on and on with the herbs, but working with a herbalist is a really, really good idea so that they can actually match the right combination of herbs for the condition, but not just because you're treating kidneys, looking at the whole patient, whether they have any gut issues, whether they have any anxiety issues, and actually sort of tailor something that's specific for that pet and what they're going through.
Absolutely. Every pet's an individual, and the more we can hone it down to that individual,
tailoring it,
the better results we're going to get in the long run. But in the short term, at least we've got a couple ideas, something you could start while you're waiting for that appointment, or at least to get your animal to start to detox a little bit and calm down that inflammation. So thank you very much, Barb. I can't wait to see you again in October.
Really looking forward to it.
We'll meet up again before then.
Yeah,
it'll be great fun.
Okay.
So thank you very much for all your knowledge. Enjoy your day.
Thank you.
Because we're ending the day. You're just starting.
All right. Bye for now.
Thanks, Barb.
Bye.